Thomas Baldrick at ASH 2014 in San Francisco. Happy to have with us Dr. Saad Usmani. He's from the Levine Cancer Institute in Charlotte, North Carolina. Thanks for spending a couple moments with us, sir.
Thank you, Tom.
Let's talk about the SWOG 1211 study. Can you give us an overview of what that is?
Sure. So the SWOG 1211 study is a multi-institutional national cooperative group trial which was initiated about a year and a half ago. There are currently no standard of care regimens for high-risk myelomas, which make up about 15% of all newly diagnosed cases. So the idea of setting up the SWOG 1211 study was to establish some benchmarks for this subgroup of patients who do not do very well with the current available therapies. Given that they make up only 15% of the patients, the SWOG 1211 was designed as a randomized phase 2 in which RVD was the standard of care arm and RVD was combined with Elotuzumab as the experimental arm. Now, Elotuzumab is a very exciting monoclonal antibody that targets a surface marker on malignant plasma cells called CS1. It is also present on normal plasma cells, but it is significantly highly expressed on the malignant plasma cells. Elotuzumab was shown in combination with Revlimid and dexamethasone in a previous study to be very effective, and based on that data, a bigger randomized phase 3 trial is examining a different question in a different patient population. But when we were designing the SWOG 1211 study, Elo appeared to be the most active monoclonal antibody. The idea was, that RVD already has some adverse events and toxicities associated with it. If we want to add another agent to it, we want to make sure that it's safe and it may add to efficacy, but not to the toxicity of the regimen. So the SWOG 1211 was designed with a phase 1 run-in portion in which RVD was combined with Elotuzumab. We took in standard as well as high-risk patients for that particular portion of the trial. And what we're reporting at ASH this year is only the phase 1 safety experience. Given the fact that the phase 2 trial is still ongoing, through the SWOG DSMB, we were not allowed to report on the response data or survival outcomes of just 6 patients. But the safety of this RVD Elotuzumab regimen is what we expected. The 6 patients who went on the phase 1 portion, only one of the patients experienced a dose-limiting toxicity, which was peripheral neuropathy at a grade 3, but there were no dose reductions in Elotuzumab. So the phase 1 safety data informed us on what dose we should use for the phase 2 portion of the study, and the phase 2 is ongoing. We are about a quarter of a way through the enrollments on the phase 2 portion.
How do the high-risk factors with these patients work into what you're trying to discover?
So that is a very important question. We have believed that multiple myeloma is perhaps a singular group of diseases, but over the past 15 years, with the advances in technology and our understanding of disease biology, we appreciate now that myeloma is many multiple myeloma, and each subset of myeloma patients perhaps may respond to different types of therapies and may have different types of outcomes. So having said that, the high-risk myeloma group is also heterogeneous. There are certain biologic variables that we know are high risk. The high risk pertains to the disease relapsing or coming back very quickly and the patients having short overall survival. So patients who have primary plasma cell leukemia are deemed to be high risk. Patients who are high risk by gene expression profiling signature are deemed to be high risk. Then there are certain chromosomal abnormalities like deletion 17p, translocation 1416 and 1420, which are deemed to be high risk features. Elevated LDH, serum LDH levels, which correlate with a more proliferative or aggressive kind of myeloma. Many times that kind of myeloma may present with extramedullary disease. That is also deemed to be a high-risk feature. So the high-risk myeloma, the 15 to 20% that I was quoting earlier, makes up all of these smaller groups. But again, to establish guiding posts instead of teasing out here, the myeloma investigators amongst the cooperative group reached a consensus that we should move forward with a trial which includes all these high-risk features and see if we can prove the hypothesis that adding a monoclonal antibody to the RVD regimen can improve the median progression-free survival for this subgroup of patients.
Very good. Come back and see us again when you have updated information, would you?
Will do. Thank you.
Thank you, sir. Nicely done.